So we've created two vaccine campaigns, Get Vaccinated and Get the Faqs. Get Vaccinated is based on feedback that we've gotten that indicates people from many different backgrounds connect with the theme of protecting their communities. The Get the Faqs campaign is based on CDC guidance, offering facts about COVID-19 vaccines in a simple and memorable way that counters common misconceptions. So these campaigns are effective if you need to broadcast messaging that's universal at a large scale. But for a more targeted campaign, it's important to partner with the communities themselves to learn what will work best. And we'll get to that in just a moment. Now, what's unique about Get Vaccinated and Get the Faqs is that they are informed by feedback from people in refugee, immigrant, and migrant communities. One way we do that is working with our community leadership board. They help us identify what topics we need to cover and what community perspectives need to be incorporated into our materials. We hold monthly meetings with them where they review our work, they inform our decision-making, and they offer guidance. We also work with our core partners who are doing work on the ground, including the International Rescue Committee, the Migrant Clinicians Network, and the National Association of City and County Health Officials, and others. They help us ensure that our materials are culturally relevant and meet the needs of the service providers that are working directly in community. Now, our campaigns include stock photos that represent many different linguistic and cultural communities, and we also incorporate design elements like dark gradients, black and white filters, and careful cropping to ensure that any community can see themselves represented in our work. Our translation process is very rigorous. Every document is translated by a professional translator, proofread by a second translator, and reviewed by a linguist. We then send the translation to somebody who is in the community who may or may not have formal language training so that they can help us make sure it's not only accurate, but culturally relevant. Finally, a linguist reviews the feedback from the community member and incorporates any necessary suggestions. Our campaigns are available in more than 40 languages. As you can see here, we have some of the more commonly translated languages like Arabic and French, but also less commonly translated languages like Popti, Mixteco, and Tamil. Our reach is national, so it's important for us to offer customizable options. We want anyone to be able to customize our materials, even if they don't have design software or a communications department. If you can use PowerPoint or Microsoft Word, you can use our templates. So we created these drag and drop templates on Google Slides. Anyone can easily, if you want to remove our logo, you want to replace it with your own logo, you want to update the URL, or use a different photo, these templates allow you to do that because we want organizations like yours to have the opportunity to do what is best for your local community. Now, part of being scalable is not relying on our campaign materials alone. So we created conversation guides on a number of different topics, and this allows bilingual community leaders, public health staff, and others to be confident in having conversations with others. And these are different than other frequently asked questions you may see online because they're not only community informed, but they incorporate those perspectives that are common in many refugee and immigrant communities. So just to summarize, as what I've just gone over, when you're talking about the Get Vaccinated and Get the Faqs campaigns, they're informed by community perspectives, written in simple language, they're designed very thoughtfully, rigorously translated, and then customizable and scalable to meet the needs of many different communities. Oh, next slide. Here's a sampling of what you can customize with our tools. Let's go back one. Yep. We have everything you need to create a campaign that is informed by communities. We had what we needed at NRC REM. We have what we needed to create mass communications campaigns in refugee and immigrant communities, but we still know how important it was to involve communities more deeply in the creation process. Now, the COVID-19 pandemic has confirmed for us what we already knew, and that's that refugees, immigrants, and migrants have the wisdom, the expertise, and the desire to influence health systems to serve their communities better. Empowering communities to work within systems can enhance any public health response that may arise in the future. We know that there are many strengths that exist in these communities that can facilitate vaccine access. And we have seen the greatest success when organizations partner with community leaders on public health solutions. So to show you how to do just that, I'm going to hand it over to IDEO.org.
Thank you, Sarita, and thank you for that segue. My name is Claudia, and I am a program lead at IDEO.org. And first of all, I'll speak a little bit about what we do, and then I'll go into more detail into the tools that we've created that we're hoping to share with you today. First of all, who are we? We are a nonprofit design studio, and our mission is to work alongside communities to design a more just and equitable world. We partner with a broad set of organizations, anywhere from government to universities, and in this case, NRC RIM, to create products and services that lead us to a more just and equitable world. One of the things that makes us different, or one of the things that is distinctive about our approach, is that we follow a process called human-centered design. And with human-centered design, what we mean by that is that the people who will be using our solutions have not just the opportunity to provide input, but are actually key decision makers and influencers in the solutions that they'll see and own. Specifically, we are big believers of community-driven design. And what that means is that people who will impact by the work are key leaders and decision makers. And this can look like many different things. It can look like surfacing challenges and needs that their communities are surfacing, to offering ideas and feedback, to helping test concepts in their communities, to acting as researchers within their communities to surface needs. Now, we've seen a lot of value in the use of human-centered design in public health. Specifically, we've seen that this approach of community-driven design leads to outputs that are relevant, because we are creating opportunities for communities to surface hyperlocal needs and hyperlocal concerns. We can then ensure that our outputs speak to those and address those concerns that exist in very specific communities. Additionally, this process and approach of community-driven design has led us to outputs that are culturally affirming. Because we understand that there's a broad diversity of views among refugee, immigrant, and migrant populations in the US, we've really emphasized the approach of creating tools that are templatized, that allow community leaders to customize messaging, to customize images, to customize every single detail so that it's really relevant and culturally affirming for their peers. Third, we've seen that this approach leads to outputs that are co-owned. We've seen that community leaders are proud to go back out into the world, share and broadcast these tools, because they were key decision makers in their creation. And finally, we've seen that this approach of human-centered design can allow us to honor multiple perspectives. Again, there's a broad diversity of views, of concerns, of beliefs, and through this approach of creating tools that can be customized and templatized by community leaders, we provide the ability for messages to be customized and to speak really to specific concerns that exist in community. Now, using this approach of human-centered design, what have we built? Through this program, in conjunction with NRC RIM, we've arrived at 3 key deliverables. Today, we'll focus on 2 of them. The first one, which I'll speak to, is Mothers for Mothers. This is a set of tools that you can use to reach caregivers in a community and to host a gathering around the COVID-19 vaccine. Now, what makes this really relevant in this moment is a lot of the emerging guidance around the vaccination of very, very young children. And this work was sparked by the insight that, often caregivers and mothers have outsized influence in health decisions that affect the whole family. Our second toolkit, which we'll touch on very briefly today, is called Make Space. And this is a toolkit to broadcast messaging broadly around the COVID-19 vaccine and to call for vaccination. And third, the third output that we'll be touching and focusing on today is called No Judgment. And this is a tool that was co-created alongside youth from IRC youth ambassadors to a set of youth we call the Youth Design Collective. And this is a tool that's really focused around creating the conditions for judgment-free conversations around the COVID-19 vaccine among youth, which we found was really important because of a lot of the polarization related to this topic. Now, let's focus a little bit on Mothers for Mothers. Mothers for Mothers is a toolkit that any organization can use to host a peer gathering of mothers or caregivers. It is an opportunity for mothers to have a break from the labor of caregiving. It is really importantly a time for her to reconnect and to be in community with other peers, something that was so difficult to do for such a long time during the pandemic. In addition, we've heard that the act of migrating can be isolating, and Mothers for Mothers provides an opportunity to counter that by creating and existing in community. And third, and most importantly, it is an opportunity for her to receive valuable information about the COVID-19 vaccine or about any other relevant health topic. How did Mothers for Mothers come about? We arrived at the design of Mothers for Mothers in collaboration with Refugee Women's Network, which is an organization that serves refugee women in Clarkston, Atlanta. In addition to partnering with Refugee Women's Network to co-create the service, we were working alongside 4 women from the Somali and Eritrean communities in Clarkston. They were, in addition to, or far beyond providing input, they were alongside us every step of the way, helping us to test tools within their communities, to surface needs that existed and surface concerns that existed in their communities, and having a say on everything from the colors that you see today to the actual format of a peer gathering. Now, are some of the key learnings that emerge from working alongside mothers in these communities that inform the ultimate design of Mothers for Mothers. On the very left side, you'll see a quote that speaks to the fact that surrogacy reviews are really essential when it comes to making health decisions. In a lot of these communities, one loud voice in favor or against the vaccine can have a big reach and big impact. Therefore, in the design of Mothers for Mothers and in the Mothers for Mothers gatherings, we've created opportunities for mothers to speak positively about their experience getting the COVID-19 vaccine. Secondly, in the middle, you'll see a quote that speaks to the fact that the pandemic is a time of a lot of unknowns, and mothers are often having to help guide and help make decisions for their whole family. One of the key elements of Mothers for Mothers is this recognition, of giving mothers information so that they can help better navigate unknowns instead of telling mothers what to do. In addition, there's a lot of emphasis in the gathering around not creating peer pressure, around not creating pulling anyone into making any health decision, but rather framing it as really equipping people with the information that they need to make their own decisions. And then finally, on the right side, you'll see a quote that speaks to the fact that in many cases, vaccination is not a common behavior in a home country or in a previous home. Therefore, in addition to making the case for the COVID-19 vaccine, we have to go back and make a case for vaccination more broadly. Now, without further ado, what did we build for Mothers, and what do we hope that you can make use of today? We built a set of tools to help any organization who wants to host a gathering save time and energy. We've created tools that help you plan a gathering, so anything from helping you pick a venue and thinking about considerations around logistics, to tools that help you promote the gathering, so tools that can help you share a poster or a social media invite and create one within minutes to share within your community. We've created tools that help you prepare to host activities and to facilitate, and that make it so that facilitators of Mothers for Mothers gatherings don't have to be public health experts to share valuable and reliable information. And then lastly, we've created a set of tools that help you present during a Mothers for Mothers gatherings, and that also help you think about follow-up on how to support individuals in your community who choose to take decisions around vaccination from attending one of these gatherings. So without further ado, let me show you how the tools work and exist. All of the tools for Mothers are housed within the NRC Run website. And again, we'll send out a link with all of these resources after our webinar today. And all of the tools are organized around those 4 moments that I outlined: plan, promote, prepare, and present. Under plan, you'll see a set of considerations around safety, around providing childcare, around transportation, and some of the elements that we found were really important to help create the conditions so that mothers from refugee and immigrant communities could attend gatherings comfortably. We've also created a set of checklists and considerations around technology. All of these sections are expandable so that once you click on them, you can find additional information to help you plan. Additionally, we've created a budget tool to help you determine how much you might need to raise in order to have, or how much you might need to budget in order to host one of these gatherings. Now, secondly, under promote, we've created all sorts of tools that help you broadcast news of this gathering within your community. First and foremost, you'll find text that you can directly copy and paste into the messaging app of your choice, be it WhatsApp, be it Facebook Messenger, Viber, whatever is most relevant in your community. Additionally, all of these text invites have already been translated into multiple languages, which you can access by clicking on the links here on the side. We've also created tools that can help you create both posters and social media invites. And so if you choose to use one of these social media invites, customizing it and making your own can be done in less than 10 minutes. Once you click on the link to customize, you'll be invited to use this template. And then once you open up the template, you'll see that creating your own is as easy as choosing whether you want a full color invite or a whiteage invite. For today, I'll choose a full color. And then we've created all sorts of instructions on the margins of the Google Slides to help you customize your invite. To use Google Slides, all you need is an internet connection. All of the software is free to use. So here you'll see instructions first to customize the characters. We've included a number of characters that represent a variety of communities. So in this case, you can quickly choose the ones that are most relevant to you. Secondly, you'll see you have the option of going in and renaming the gathering to whatever is most relevant in your community. You have the ability to change the text. You can also remove the logo and replace it with your own. And then finally, you can add a sticker mark that best represents your community. In my case, I am Venezuelan, and so I'll choose a mark that closely represents our flag. And then whenever you're ready to share this on social media, you'll see that doing so is as easy as downloading an image and then sharing it on the channel of your choice. So now you've picked a location, you've picked a date, and you've shared the news of the event with your community. What do you actually do during a Mothers for Mothers gathering? We've created a whole section here to help you prepare. Here you'll find an agenda where you can replace the names of who's going to be facilitating what section. And then for all of the sections of Mothers for Mothers, we've created a set of activities. Here in the website, you'll see how mothers should feel, the suggested time that this activity should take. You'll find information around the concepts of each activity, as well as a sample script that you can adapt, translate, customize, and use day of to help you present. You'll also see corresponding slides, and these corresponding slides will correspond to this presentation that you can directly share day of. So as you'll see, the section that we were just looking at was slides 9 and 10, and here in slides 9 and 10, you'll see the same text script copied into the speaker notes so that you don't have to kind of go back and forth if you don't want to. Now, broadly, the sections of Mothers for Mothers include an introduction moment, then an icebreaker moment, and most importantly, they include a moment of agreement. This is a really essential moment where participants agree on how their information will or will not be shared beyond the group, They agree on how they will respond to individuals who have, say, different opinions, how they'll respond to different topics. This is really a moment of establishing social and psychological safety during a gathering. And then this then leads into the introduction of the health topic. You'll see here that there's a moment for sharing videos, and you'll find instructions really on how to select your own video if you would like, or even how to build your own video. After the break, we go into the health topic discussion. In this case, the first Mothers for Mothers gathering has all been focused around the COVID-19 vaccine. And to help individuals who are not health experts facilitate a gathering, we've created a set of concern cards that include FAQs that are relevant to concerns we've heard from refugee, immigrant, and migrant mothers, such as implications on do I need to be a citizen to get a vaccine? Do I need health insurance? All the way down to possible side effects around children, which is, of course, one of the concerns that is really relevant among this group of individuals. And then finally, there is a closing moment. When you're ready to present, you'll see both a sign-in sheet, the presentation slides, as well as follow-up text. So that you can follow up with the participants of a gathering and help them make decisions, help them receive more information. Finally, at the very bottom, you'll see some of the Get the Facts materials that Sarita was referencing, as well as instructions on how to use the Mothers for Mothers meetup tools to host gatherings on other topics. We've just done the demo. Finally, I'll end by sharing a couple of stories of how we've seen Mothers for Mothers adapted and run by a variety of organizations. All of these tools are open source, free to use, and we invite you to adapt them so that they're really right and relevant for your communities. In the case of Refugee Women's Networks, we know that they have started Mothers for Mothers groups with 6 different refugee, immigrant, and migrant communities, and that they've done about 3 or 4 gatherings with these groups. So initially they were hosting some gatherings around the COVID-19 vaccine, and then they shifted to having like the 3rd or the 4th meetup be about a different health topic that was relevant in the community, in some cases around nutrition and Ramadan. Additionally, you'll see in the slides some posters from Restoration for All, which is a group that is combining Mothers for Mothers with a community healing circle component. And then in the center of the slide, you'll see an image from Congolese Patriot, which is combining Mothers for Mothers gatherings and is hosting gatherings both around the COVID-19 vaccine and also around OBGYN visits and what to expect. Next, I'll pass it off to Rivi, who will go into depth about another toolkit that we have created and want to share with you all.
Wonderful. Thank you so much, Claudia. And as Claudia mentioned, the second toolkit that we wanted to share with you all today is called #NoJudgment. And this is all around reaching young people from refugee, immigrant, and migrant communities that you might be serving. And so the idea here is all around sparking and practicing judgment-free conversations, learning how to have those judgment-free conversations, and then creating space for that. So what we heard, as Claudia mentioned, we worked with a number of young people across refugee, immigrant, and migrant communities across the US. And what we heard was that young people are really having a hard time having a conversation about the vaccine with their peers, with their family, in school, in the various circles of their lives. And so they really wanted a space and a way to have a conversation that felt depolarized, that felt judgment-free. And so our team's goal, alongside a couple of youth designers, was to create a set of tools which CBOs are then empowered, community-based organizations are empowered to initiate and create spaces for that judgment-free conversation that young people are excited to join. And the idea is that if we create spaces where young people are able to talk openly and honestly about the vaccine, about their concerns and hesitations, this might create opportunities for mindset shifts, which then ultimately leads to vaccine uptake. And as we've mentioned before, we worked with a number of young people from refugee, immigrant, and migrant communities to co-design these tools. Pictured here are the International Rescue Committee's youth ambassadors, as well as a group of young people that we convened called the Youth Design Collective, and they represent a range of backgrounds from refugee and immigrant communities. And so I'll share kind of an overview of all of the tools that are available on the No Judgment website. There are tools where you can have conversation tips and practice tools where you're able to like view tips, and Textversation that helps you kind of actually practice what it would be like to have a judgment-free conversation. And you can also see video examples of what a judgment-free conversation could look like. You'll find tools for community-based organizations to host group conversations, and there are worksheets that will help you walk through the roles, the logistics, the agenda of creating that group conversation. Somewhat similar to what you saw Claudia just share from Mothers from Others, but obviously tailored to reaching young people from refugee, immigrant, and migrant communities. We also have a set of tools around vaccine frequently asked questions around the safety of the vaccine, cultural and societal concerns, and legal concerns, all of which are written in a way that is really easy to understand. It's jargon-free. It was actually written by the young people that we worked with and then fact-checked by physicians at the University of Minnesota. And finally, we have a set of tools around spreading the word and sparking these conversations. So we have social media posts and BuzzFeed quizzes that really invite young people into the conversation. And with that, I will actually walk us through the No Judgment website so you can get a sense of what's available on the website. So when you land on the homepage, you'll see kind of just an intro to what these tools are about. And you'll see the same for options of what tools you can dive into on the website: the conversation tips and practice, group conversations, vaccine FAQs, and social media posts. And if you click into this page, I've opened them up for the sake of time, so I'll just run through these tabs. On the page around conversation tips and practice, you'll find tips for a safe and judgment-free conversation. And they're kind of a set of principles that anyone can use to have a judgment-free conversation. And it gives you also examples of, for example, if you hear something, this is what you might say that kind of indicates that you're starting by listening. Or, for example, reflecting back what you've heard. For example, if you hear that it feels too risky to get the vaccine right now, I'd rather wait and see what happens in a couple of months. In order to reflect back what you hear in a judgment-free way, you would kind of validate what you're hearing and reflect back. So yeah, that makes sense. So it sounds like you don't think the risk of getting the vaccine is worth it right now, and you'd rather wait and see how it goes for others first. And obviously these are meant to be used in conjunction. So you start by listening, reflecting back what you heard, and kind of like offering a multitude of ways that you could have a conversation in a more judgment-free way. We also have a tool that we mentioned earlier called the Textversation, and this is a way to practice a judgment-free conversation. So you can try out this interactive text conversation. If you click this button, it'll open up this image into a larger screen, and you can actually click directly on this phone to use the tool. So for example, it shows you a couple, kind of like a simulated chat between two young people. And as you continue to have the conversation, it will invite you to choose a response. And so, for example, if I'm feeling kind of snarky today, I might choose this one. And you kind of see what that would invite from the other person. And this Textversation actually gives you real-time feedback of what is the response that you chose. Is that judgment-free? Maybe not so much. And it gives you an option that might be a bit more open and judgment-free. And so if you were to select the less judgmental response option, it kind of validates that choice and tells you why that was maybe the right choice. And so this is really a tool for young people and really kind of anyone, but really tailored towards young people to show how you might have that judgment-free conversation using kind of a real-time practice tool. The next set of materials on the No Judgment website are around hosting that group conversation. So when you go to this page, you'll see that there are a couple of different worksheets that are intended to help you really from start to finish create that space for a group conversation that's judgment-free. So you're able to choose your roles, plan the logistics of it, and actually build the agenda. And so if you were to click on this page where you get the roles worksheet, I think I've opened it up here. it'll look like a page like this, and you're again invited to use the template. And once you click that button, you'll get your own copy of this document where you're able to type in yourself, who will be the logistics mastermind for your event. Maybe that's me for our event, and you're able to use this for your own organization. And so all of the materials that are in the hosting your tools, and really all of the materials within this website, are again built on Google Slides. So it is all free to use. And all you really need is an internet connection and the ability to access these tools on the internet. And the last tool that I wanted to direct your attention to is the vaccine FAQs. And so these are a set of tools, like we said earlier, that are really all around giving some information that is clear, accurate, and jargon-free, and really tailored towards young people around whether the vaccine is safe, some concerns about the price and the legal requirements, what your friends and family might think, or whether there's historical distrust in institutions. And so if you click on any of these, and it'll direct you to that, but you can also just scroll down and see the drop downs here that are available. So for example, if you're worried about the Omicron variant and how it's different, it gives you really simple bullet point information, how the vaccine might affect your period, simple, short information to help you address any of those concerns. So those are kind of an overview of the tools that are available on the No Judgment website. We do have time for questions at the end, so if you do have any questions about any of these tools, please do drop them in the chat. And with that, I will share a little bit, just briefly, about our tools around Vaccination Is and Make Space. These are really a set of tools to help you reach communities, refugee, immigrant, and migrant communities broadly. And so the main slogan is Vaccination Is blank, and it's meant to be kind of an invitation for communities to fill in that blank, whether it's love, hope, strength, protection, or something that might be more significant or meaningful to your community. And the Vaccination Is materials have a lot of different manifestations. So there are materials to help you engage your community, and those might be posters or social media graphics, tools to help you inform, which might be social media stories or fact sheets, tools to help you reassure if there are more complex issues or misconceptions circulating around the community. You might use a comic strip in order to be able to say a little bit more about why you might need to wait 2 weeks in order to get the second dose of the vaccine. And finally, there are tools to help you promote. So stickers that you can customize and profile picture overlays. And everything that's created here for the Vaccination Is campaign is meant to be very hyper-local to individual communities. And there, on the NRC Room website, there are 11 languages that are available for all of these materials that are ready to use. But we also have this tool, which we're calling Make Space, which allows anyone to create any of these materials with 5 minutes or less, essentially. And you'll see here in this little GIF that it's really just a drag and drop situation. You don't need fancy tools. It's really similar to the demonstration that Sarita showed us earlier, and Claudia did as well. So really all of these tools are meant to be really hyper local to communities, and it's a way to reach your community broadly about vaccine confidence. And with that, I will pass it back to Sarita to facilitate the question and answers.
Thanks so much for showing us all those resources. We do have a few questions that came in, but I invite anyone from the audience to either raise your hand, or you can add a question in the chat or using the Q&A feature. So my first question is, I think a lot of people are experiencing pandemic fatigue right now, and there's some really good resources here for having conversations with others. But, considering this pandemic fatigue, some people might not want to have the conversation at all. And so what advice do you have for overcoming this so that you can actually have a productive conversation?
Thank you, Sarita. I'll address that by pointing to some of the not techniques, but some of the things that our partner and especially our pilot partners have been doing around this. So especially when it comes to the application of Mothers for Mothers, we've seen a lot of tailoring to really relevant health topics, right? And so instead of doing what RWN has done, which is having 1 or 2 gatherings around the COVID-19 vaccine and then shifting to having gatherings around, say, nutrition during Ramadan, we've seen other partners who are actually doing the opposite, like being really attentive to their community's needs and having, say, the first gathering be around OBGYN visits, and then shifting eventually, like building that trust and speaking to what's really top of mind for the community. And then slowly kind of after that trust has been built, after that community has been established, and especially that moment to be in community has been established, shifting the focus towards the COVID-19 vaccine whenever relevant.
I think that's a really good point about, I hear you saying that it's okay if somebody doesn't want to get the vaccine like today or doesn't even want to talk about the vaccine today. But what you're doing is you're investing in the future and you're creating like a really trusting foundation and a relationship so that maybe you can eventually have that conversation, and that is still definitely worthwhile. And I think I have a question that's related to that, which is, I know the CDC just recommended COVID-19 vaccines for children and young babies. And so how do you see these resources meeting the need of this moment?
Go ahead. Okay. Maybe I'll just start off on this question. Claudia, please do jump in. I'll speak to the no judgment tools specifically. I think what's really great about what we've seen, how the no judgment tools have been used, is actually like when we're seeing gatherings of young people, it's not necessarily about those, young adults being vaccinated. It's actually a moment for those young people to build confidence and them becoming kind of ambassadors for the vaccine. And so what we've seen and what we tend to know is that young adults can be influencers in their family for younger siblings to get vaccinated, with kind of convincing parents to help make that decision. And so you could utilize the no judgment tools as a way to kind of deputize young people in your community to be ambassadors and influencers for the vaccine for younger siblings in the family or potentially others in their community. And I'll pass to Claudia to add to that.
Before Claudia, you go, I'll just add to that because I think that's really important. What we heard from the youth ambassadors when we were creating some of this work is that youth often, they're kind of a bridge between cultures, between their families, their parents, and the greater sort of American culture that they find themselves in. And they can be hugely influential, especially like teen or young adult children. They can be hugely influential, not just with their parents, but also with decisions involving their younger siblings. And so I love how you're saying, like, how can we equip young people to be more confident and having those conversations? I think that's really important. Claudia, did you have anything to add?
Thank you both. I think you've both made great points. I think the one thing that I would add, again, with a focus on the Mothers for Mothers toolkit, is that nugget that we heard about the importance of surrogacy reviews, especially in the agenda of Mothers for Mothers, as an opportunity to play video stories. And instead, it'd be really easy and simple to replace that with having or inviting mothers in the community who feel comfortable sharing about their experience and their reasoning behind their decision to get their babies vaccinated. That can be a really important touch point and point of information for someone to make a decision, to be encouraged by seeing other people in the community who have made this decision, who have thought through the implications, and who have also perhaps validating some of the concerns that someone might be feeling about making this decision.
Yeah, I love that both of these tools, but in particular, the one for mothers really relies on storytelling and testimonials. And we've heard that has been really effective, like much more effective than coming at people with data. I'm going to share a link in the chat, nicrem.org/children, and that goes to our whole suite of resources on vaccines for children, if you're in a position to talk to parents about that decision. One thing that we have on that page that's really popular is a video. It's an animated video, and it's available in 14 languages, and it tells the story of an immigrant mother as she explains her decision to vaccinate her two children against COVID-19. It's called Children Keep My Community Strong. And then we have another one as a sequel that tells the same story from the perspective of a father. And so that's kind of leaning on that storytelling element that you could definitely use as part of your presentation for Mothers for Mothers. We did have a question come in the chat. But somebody's asking, how can we persuade the youth to be fully vaccinated? And I think really you might be the best position to answer this one.
Sure, yeah. I think what we have, I'll again just rely on what we've heard from our community partners who are actually using these tools. What we've heard from a group out in Houston is that one, they're using the no judgment tools to host events, to host kind of just like these group spaces for conversation. And I think what they've seen a lot of success with in getting people fully vaccinated and even getting people that fourth shot, the like extra booster shot, is really just one, just like creating the space to have people even, share any hesitations or concerns that they might have, because often, if you've gotten the first shot or you don't have you've gotten the first two and maybe don't have your booster yet, is that you're generally open to getting vaccinated, but it's kind of this there may be some extra concerns that you have or hurdles that you might be facing, barriers in terms of just getting, how can I have a lot of homework, or I don't know what the barrier might be, but there, things come up in life. And so it might just be a space to open up that conversation. And I think one thing that's highlighted in the no judgment tools is kind of starting from a place of shared viewpoints. So for example, starting from a place of okay, it sounds like you see the value of this, but maybe you're finding barriers in actually getting to the appointment, or you're having trouble making the appointment. And so maybe starting from that place of shared perspective is the way to go. I hope that's somewhat helpful. I think it's a really hard thing also. It's what we've also seen is that it's sometimes multiple touch points that really get people to get fully vaccinated. So no easy answers, but maybe something helpful in that.
Yeah, that's definitely really important, of starting with, what you have in common, kind of building off that, trying to identify maybe access barriers or other kinds of hesitancies, having that conversation, like I said, before the vaccines. The person might not want to get vaccinated that day, but just being able to have that conversation is going to be hugely helpful in the long term. I'm going to launch a poll really quick for some of our, just like a quick survey about this webinar, but we can definitely keep talking. So Claudia, did you have anything to add before we move on to the next question? Okay. So what advice would you give to somebody who wants to use these tools, but they have limited resources?
I think that's a great question. And I think there's a variety of tactics that can be used to pick and choose from the tools. And that's essentially the main piece of advice, is to look through the tools and then select the elements that you would really like to implement. For instance, again, with the lens of Mothers for Mothers, we have seen that there are groups who are hosting physical gatherings, which of course requires more resources, requires space, requires technology. So we've also seen groups who are hosting these gatherings online, just via Zoom, given that's where a lot of our lives tend to happen these days. And of course, there's additional time and energy required in making sure that everybody in the community has a device or has the ability to join a call on Zoom. But of course, having the meetup virtually changes a lot of the requirements around resources. I would say also there's little things, especially I'll pass it on to Vivi to kind of speak to this, but especially with no judgment, there's a lot of little tools that can be implemented in isolation, which still allows someone to take action and take valuable action, say by taking one of our tools that are free to use and adapting a template and making a social media post. You could all do that in 10 minutes right after this call, and there's no financial cost to it.
Yeah, I think I was thinking the same thing, Claudia. It's just, I think what's available through all of these tools is really awesome. And there is a variety of tools, but I hope that doesn't become a barrier because it's like, there's so much and what should I dive into first? So please take this as an opportunity to just like pick one thing that you think might work for your community and add that to whatever existing programming that you might have. Because I know you all are doing a lot of work around this. And so it might just be a matter of like taking one thing and like starting with, social media posts, or it's a BuzzFeed quiz that you're sharing with young people in your community just to start to get that conversation happening. I'm trying to think of other ways. I think one thing that we've seen work really well with our community partners is that, often these community-based organizations have networks. So for example, they might have like community health navigators or health promoters within their communities who are kind of like the arms of the organization reaching out into the community. And so really like, I guess I keep using the word deputizing, but sort of empowering and having those folks really feel some ownership over these tools so that they can then kind of do that work of community-based work on behalf of your organization. And I realize that, not every organization has the personnel resources. So I think, yeah, doing what you can with the set of tools that are available, but then also deputizing others to go out and do this work as well.
Yeah, something we were really careful about, both in the NRC materials I shared at the beginning and these two toolkits that you're sharing with us, is that you don't need to have a graphic designer on staff. You don't need special software. Even with a Chromebook, like a really simple computer, you can create some of these materials. And I think your point about not feeling like you have to do everything at once is really important. We also have NRC RIM has small grants. I'll share in the chat. We have something called a printing mini grant. So if you'd like to host something and printing is a barrier for you, we can cover some of the costs of printing. And then specifically for Mothers for Mothers, if you'd like to host a Mothers for Mothers meetup, and you are looking for a little extra so that you can pay for like a stipend for staff time, printing costs, other things like that, you can email us, and I'll put our email address in the chat, and I'll send everyone an email afterwards. But just let us know, just inquire with us, and we can see if we can help cover some of those costs for you. If you haven't taken the poll, please do so. I guess my next question is there anything that surprised you when you were going through this, working with youth or working with mothers? Like, is there anything that really sort of challenged your perspectives or gave you new ideas?
I can start out with this one. I think one thing for the no judgment tools was that we were very intentional about wanting to create tools that felt specific and resonant with young people from refugee, immigrant, and migrant communities. And one of the things that we actually heard from the young people we were co-designing with was that sometimes putting that label of this is for refugee, immigrant, migrant communities, this is for you, like a specific category of youth, is sometimes othering. And that we're trying to strike that balance, or like toe the line of like trying to be inclusive and make sure it's resonant for communities, but also making sure that we're not othering folks by putting labels on materials. And so I think some of the ways that we've done that is, one, there's no mention of necessarily like having like calling all young people from refugee, immigrant, migrant communities on the outward materials, but making sure that, for example, in the vaccine FAQs, that there are some concerns that might be more resonant or might be things that people from refugee, immigrant, migrant communities might be facing. For example, wanting to speak with your family about the decision to get vaccinated, wanting to understand what the legal structures are around getting vaccinated, what are the costs of getting vaccinated. And so we're trying to incorporate that lens and intentionality in more subtle ways, I think, with some of these tools. And so that was a big learning for our team, for sure.
That is a really good point. Claudia, do you have anything to add?
Yes, I think one point is kind of, well, 2 points in relation to what Ridley was saying. I think when it came to research, we realized that there's, depending on who we're designing with, there's overlapping concerns, right? So there is not necessarily a set of concerns that are specific to youth from refugee, immigrant, and migrant communities that are totally different from the concerns of youth around the COVID-19 vaccine, right? It's especially with when working with mothers, you know, there's a set of concerns that generally mothers want addressed around the COVID-19 vaccines. And then there's an additional kind of layer of concerns that can be specific to coming from a refugee, immigrant, and migrant community. And so in building these materials, it's really important to kind of understand, validate, and address all of those layers. The second point, which we touched upon already, but just to give it a little bit more color, was around the real importance of the storytelling and of the surrogacy reviews. Right? When we were doing research, we learned of one instance where there'd been one loud voice in the community who had gotten the Pfizer vaccine and had gotten had gotten sick afterwards, but had been a very loud voice in that community, so much so that people in that community were very hesitant to get specifically the Pfizer vaccine. And so kind of to counter, to address that, you know, we have created a lot of opportunities for those positive surrogacy reviews to come out in these gatherings, right? And so I think, touching back on what we've already kind of underlined a little bit, but really like the importance of these stories, the importance of hearing about others' experiences, and about creating space for others to share positive experiences around getting the vaccine.
Yeah, I think the importance of both storytelling and trusted messengers could not be overstated. You know, as you're saying, there could be one loud voice that has a lot of influence, and that person is probably really trusted in the community, and that makes total sense. We actually heard of a situation, I think it was in Arizona, where there was a woman, an immigrant woman, who owned a clothing store, and she had a group of very I should say, like very loyal customers, and she would always sell out of stuff. And so she had this WhatsApp group, and she would message them when she got in new fabric. So when she got in new materials and new styles, you know, to encourage folks to come in. And she actually worked with a refugee resettlement agency, like a refugee resettlement agency contacted her and said, hey, can we use your groups to send information about COVID-19 vaccines? And so it's like, this is just a woman in the community, a small business owner, but also really influential. And like, how can you work with these people to really get this information out? And imagine if you could work with somebody like that to perhaps help, you know, she might be able to help you communicate about a Mothers for Mothers meetup, you know, and be able to really recruit people for that. So yeah, definitely storytelling, definitely trusted messengers. We only have about 3 minutes left. I'll invite anyone to drop any questions in the chat, or if you just have a challenge that you're trying to work through, go ahead and raise your hand. We'd love to allow you to unmute and sort of talk through that. I know somebody asked in the chat, and I responded in the chat, but I'll respond live as well. Asked me to repeat the part about the funding that we have. So if you can email us at nrcrim@umn.edu, it's in the chat, and I'll email you afterwards. Email us if you'd like to host Mothers for Mothers in your organization, but cost is a barrier. We do have mini grants available, just a limited number of mini grants, but we do have a couple spots left for organizations who are looking for additional funding. So definitely reach out to us. We'd be happy to support your work. I guess I'll just ask Claudia and Rudy, do you have any final thoughts?
Just a lot of gratitude for the time to share this with you all. And if anyone does use the tools, please do share back how you've used the tools and what you've seen work and what didn't work so well. We're really open to hearing feedback, but also would love to hear your successes.
I echo what Ruby said. Thank you all for making time and space to read about these tools and learn about them today. Do let us know if you use them. We are developing additional tools as we speak. And so any feedback around how access or application definitely informs our work going forwards.
And I guess my only closing thought, in addition to the gratitude, is just to say how much I have really enjoyed working with communities to really bring our work to the next level. My dog is very enthusiastic. I guess we'll close the webinar. Take care, everyone. Have a good afternoon.
Thank you everyone for joining.
Have a great day, everyone. Bye.